Hi, this is Dr. Kurt Wohler for Integrative Medicine Academy. The title of this short video is Hypothalamus-pituitary-adrenal axis influence over the hypothalamus-pituitary-thyroid axis. So this video, we're going to look at this particular slide and talk about a couple different angles to consider clinically with regards to HPA axis and HPT function. So on the left-hand side, what we see is the hypothalamus-pituitary-adrenal axis. And so this stress input is meant to indicate that various chronic stressors, psychological, traumatic, electromagnetic, allergic, etc., have chemical signals through the hypothalamus that communicate with the pituitary through the production of cortical-releasing hormone that tells the pituitary to output ACTH, the adrenal corticotropic stimulating hormone, essentially, that conveys a message to the adrenal cortex to produce cortisol. So hypothalamus producing CRH telling the pituitary to output ACTH tells the adrenal cortex to output cortisol. And so that's a typical response that occurs every single day of our lives with regards to HPA axis engagement for cortisol production and the regulation of various cellular function and body metabolism. Now, we also produce DHEA from our adrenal glands as well. And then within the medulla, we actually produce the catecholamines, so that have a stimulatory effect as well. Now, the HPT, or the hypothalamus-pituitary-thyroid axis, is similar. So the stress inputs into the hypothalamus can help us produce a hormone called TRH, which tells our pituitary to output TSH, or thyroid stimulating hormone, that tells our thyroid to produce T4. We do produce a little bit of T3 as well. Now, what's interesting is that under chronic stress, increasing levels of cortisol can have an inhibitory effect on thyroid function. So T4 to T3 can be inhibited through the actions of cortisol. So we can inhibit the conversion of T4 to T3, and we know that T3 is the active form of thyroid hormone. Turns out that cortisol can also inhibit TSH. Now, CRH from the hypothalamus in the HPA axis can also inhibit TSH. So there is a significant role that the HPA axis has over thyroid production. And so one of the things to keep in mind is that anybody who may be exhibiting symptoms of what would be considered hypothyroidism, it's also important to check the HPA axis, so looking at cortisol and DHEA. Because you may find that people either need less thyroid hormone or their thyroid situation, particularly low thyroid function, just improves sort of on its own when you address issues within the HPA axis. Now, a couple things to consider that often happen in thyroid problems, particularly hypothyroidism, is you can have low production of T3. So if you ever have a situation where you may have adequate T4 but low T3, there's a couple things to consider. One of those being certainly cortisol having an impact, but also the component of reverse T3. Now, reverse T3 can actually go up because of stress. And reverse T3 is also an inhibitor of that T4 to T3 conversion. So that's not to say that in every case with hypothyroidism, medication or thyroid support is not warranted. Or it doesn't mean that in every scenario the thyroid issue is going to automatically be linked 100% to a hypothalamus-pituitary-adrenal axis issue. But as integrative and functional medicine physicians, we're really trained to look deeper at these issues and understand the physiology and understand the relationship between these systems. so that when we support HPA, we're also supporting the HPT and not just focus on doing TSH as the only assessment for thyroid. And because it's normal, we say, okay, therefore this person does not have a thyroid problem. A real comprehensive approach, as just mentioned, is to actually measure within the context of thyroid assessment, is to measure TSH, is to measure free T4 and free T3, and even get a one-time reverse T3, and also look at the antibodies that are important for negative impact on the thyroid, as well as looking at cortisol and DHEA through a salivary test. So it's an interesting slide when you start diving into it a little bit deeper and understanding that we have a regulatory effect over our thyroid metabolism being linked back to the HPA axis. Now, this topic and many more are discussed in our Hormone Mastery course as part of Integrative Medicine Academy. For more information, you can go to hormonemasterycourse.com. If you are a healthcare practitioner, we also have a membership website for healthcare practitioners wanting more assistance with lab test interpretation, clinical case study, clinical troubleshooting. Functionalmedicinclinicalrounds.com is that website that provides you access to myself and my partner in Integrative Medicine Academy, the ability to schedule with us one-on-one to go over various labs or talk about cases or troubleshoot. We also have educational material in this website. There's videos, lectures. And we also have these things called clinical data sheets, which are one-page documents that profile a lab test or a lab test marker or different clinical pearls. These are downloadable as PDF documents within the website. There's also a forum within the Functional Medicine Clinical Rounds site for ongoing Q&A. Functionalmedicinclinicalrounds.com. If you have any interest in our other mastery courses through Integrative Medicine Academy, please go to the website integrativemedicineacademy.com. If you have any general questions, you can email to integrativemedicineacademy@gmail.com. Again, I'm Dr. Kurt Wohler for Integrative Medicine Academy. Thank you.